Okay. I don't want to hurt anything. All right. All right, so our topic for today is silence. And again, we can approach this from both a cultural perspective, but also just a general perspective, is that in some cultures, silence is seen as something that is appropriate. It's time for reflection. It's time to really gain trust of another human being. In some cultures, especially if we call it the kind of more the dominant American culture, silence is not tolerated very well. It makes a lot of individuals uncomfortable, and it can lead to some awkward moments within the treatment process. But if silence is used right, it can actually promote healing. It can promote wellness. So that's kind of why it's an important kind of topic to go over as one of the skills, and we'll call it a skill because there are so many people who are uncomfortable with it. It takes a while to kind of gain momentum with it, especially for the therapist themselves. Okay, because a lot of times when we think people aren't responding, we think they're not responding because they don't trust us or they don't want to release something to us or something like that, when in reality, they may just be collecting their thoughts and thinking through their own process. Okay. So when we talk about silence, there's three main things that it enables us to do. Okay. And silence allows counseling. Silence in counseling allows the client to speak about their issues without interruption. Okay, so proper use of silence allows a client to just sit there and reflect on a question that is asked and just be in that moment. But it also can be in an empowerment moment because you're giving them permission to take as much time as they need to collect their thoughts, collect their feelings, and really put what they want to say into action. Okay. Silence also enables a client space to process the thoughts and feelings without distraction, as we just mentioned, and it helps to gain clarity, face and consider possible moving forward. So it allows time to really reflect on things. Okay. Now, I just mentioned that silence a lot of times is not tolerated. Okay. Because it brings up anxiety, not necessarily with the people being asked a question, but from the person asking the question. Okay. If we look at research on teachers and college professors, the average time a professor waits to decide the class doesn't know an answer. Does anybody know? So professor asks a question. How long does the average professor wait for students to respond? What do you think?
15 to 20 seconds.
15 to 20 seconds.
I'll see 5 to 10.
5 to 10. How about online? How much time do you think the average professor waits for a response after asking a question?
I'll say 10 to 15 seconds.
All right, 10 to 15.
I'd say 5 to 10 minutes.
5 to 10.
I'll say 30 seconds.
30. All right. Well, you guys are very optimistic. It's actually 2.5 seconds. And that's actually when we look at it in just people asking people questions, not within a classroom setting, the average time is about 5 seconds. Okay. The problem with that is, is it takes us 4 to 5 seconds to comprehend a question, and then it takes an additional 10 to 7 seconds to initiate a response if we understand the question itself, and then longer if we need to process that question. So the average amount of time that we should wait, the minimum amount of time that we really should wait in a counseling session before we try to move on, is about 20 seconds. okay? And in 20 seconds, you can look at them and just say, do you need some clarification about what I'm asking? You just don't move on. You just ask if they need any more information to get to understand their response, okay? So this is a now why did some say 10 to 15 seconds and some say 5 to 10 seconds and stuff like that? Because in our minds, when we're asked a question, time tends to slow. I know that sounds impossible, but yes, we can slow and speed up the perception of time. And it feels like an instructor or someone is waiting a long time for your response. But on average, it's about 2.5 seconds. And again, going back to this research, we asked class, hey, how long did your professor wait before they went ahead and answered the questions? And they gave much similar responses you guys did, 5 seconds, 10 seconds, 30 seconds. But on average, it was 2.5 seconds, okay? So that's where we as therapists especially need to make the conscious effort to hold out for at least that 20 seconds, okay? And it may seem forever to the client, but if you're giving them permission to process that information, the first few times may seem awkward to them, but then after that, they're just gonna realize you're waiting for their honest response, okay? Now, when I first started doing counseling and stuff, and I got a tip from some excellent supervisors, one way to practice this is when you ask someone a question from now on, count in your head from 0 to 20. So 0. And then when you get to 20, move on, okay? And so think about that as we think about silence. And that's one of the things that took me a long time to not have to count. But that's one way you can practice asking a question and actually waiting for a response, okay? Now, the other reason we want to do this is because has anybody ever, someone ask you a question and you give the instant response, and then later on you go, God, I wish I would have said something else, or I wish I would have said this, okay? Well, this is how we have set up our fast-paced society, that we want rapid responses, okay? And so instantly, when a client feels pressured to answer a question, they're probably going to give a response. And then hopefully later in the session, they may go, by the way, when I answered that question earlier, I really meant this, okay? And so that's the other reason we want to provide that amount of silence and make it comfortable for them. And so they give that response that they want to give after they've actually thought about the question, not that instant pressured response, okay? So let's take a look. So what are some of the functions of silence? Again, there's about 2 main ones. One is it allows the client to tell their story and feel heard and validated, okay? But it also has a good purpose for the counselor as well. If you think about that, those silent moments can be a mental break where you can process what you're doing in the counseling session. You can kind of start taking mental notes. You can actually do work in your head or whatnot while that silence is occurring, okay? So for the counselor, you can gain a deeper understanding of the speaker's issues, and it provides a useful space for the counselor to consider appropriate responses to the client's stories once they're told. So, there's 2 parts of this. One, silence can be used by the counselor when proposing a question to the client, gives you time to kind of collect your thoughts, but also using silence on the counselor end. So a client tells a story and you take a moment of silence and you make sure your nonverbals you're reflecting on what they said, you're collecting what they said, and you provide that silence, and then you kind of do that. So what I heard you say is, and correct me if I'm wrong, da, 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 da. So silence goes both ways, okay? And you'll have a good relationship with your client when they allow you to have that moment of silence, when you're collecting your own thoughts, okay? That's a good marker that you've got a good relationship going on. Okay. Culturally, we have been taught to be, especially in our Western United States culture, we've been taught to be uncomfortable with silence. This can influence a counselor's use of silence, as we've talked about before, okay? And again, new counselors tend to be very uncomfortable with it, with pauses, and they rush to fill in the gaps with information, and that's not a very useful part for that time, because you can go totally in the wrong direction, okay? And again, when I had to learn how to use silence, that's what I often did. I tried to fill in those gaps right away because I was uncomfortable. And that's when my supervisor came and said, okay, this is what I want you to do. Next time, count in your head to 20 and then move forward. And it does, it improves what you're trying to do. And because you're mentally counting, you're not processing your own ways that you want to fill in that space, because you're cognitively loading your brain by counting. So you're going to keep that space clear so that you can then listen to the response that is being provided, okay? And again, it goes to inappropriate response. And again, if we go back to that person-centered approach, we need to be able to trust our clients to set the pace for the session, okay? And trust them and give them, again, that empowerment to be able to control and answer the way they feel they want to, okay? The counselor gives client control, again, of the content. And again, silence may facilitate the counseling process, okay? Because it allows for this open and honest communication. I will say again, when I started to supervise, I supervised addiction counselors for a while. And it's interesting because we know in addiction, a lot of clients are really uncomfortable with actually revealing their actual amount of use and the things that they've done while they've been using and the reasons why they're using, okay? And it was interesting because those counselors who just wanted to push the session forward, I got to get through, maybe they had a manualized session, so they were reading instructions, okay? They got less honest response because they were trying to pressure the session along. But the counselors who followed the manual the way it was supposed to, but they allowed the conversation to happen. They allowed silence to happen. Compared to intakes to what was being said in the counseling room, it was two different worlds. I remember one time just with one gentleman, he said he had 2 drinks a night, okay? In the counseling session though, it was 2 drinks in the morning, 1 for lunch, and 4 or 5 drinks in the evening. And when I talk about drinks, I'm talking about neat-sized whiskey. So it's a double shot of whiskey. So he was having 2 in the morning, 2 at noon, and 4 or 5 in the evening. But we wouldn't have got to that point unless that counselor was allowing that space for that person then to be honest in the treatment process to say, well, you know, I know in intake I said but this is, you know, what I'm actually doing. So, and that's just an example of some of the effectiveness of silence. I know like within trauma-based groups, a lot of, I'll use survivors of, for example, domestic violence, okay, will often want to minimize the trauma and everything they've gone through, okay? And again, I've seen with the effective use of silence, really learning the relationship dynamics and the things that go on in those kind of relationships. And they're very different from even the police reports and what the survivor said on intake, okay? So that's, again, it facilitates that process because you start to be honest with each other and not feel like you just have to give the, the socially appropriate response, okay? And for addicts, it's minimizing. survivors, it's making it look like that the abuse wasn't as bad as it really was. Okay. Okay, for counselors, a deliberate use of silence allows the clients to do self-exploration. Deliberate use carry the burden of the conversation. And again, I know this sounds negative about having the client carry the burden of the conversation, but again, this is their counseling session, right? The person who really should be the one that's guiding it should be your client, okay? Yes, you're facilitating to a point of healing and treatment, but they're the ones that have to take that journey. It's not the counselors that's taking the journey, okay? An organizational use of silence allows the counselor to collect his or her own thoughts. A natural ending phase of a discussion is also good for silence. So I want to ask you, what do you think it means by, so we ask a question and we have silence, okay? Where else in like a group or a counseling session, even if we're not asking a question, when would we deliberately place silence in that session beyond asking a question? So I'm asking for our Zoom, you can unmute yourself. You could put it in the chat. Why do you think, we would, when do you think we would use silence beyond asking a question?
In the response.
Okay, what do you mean by that? That's perfect.
The client time to respond, and then you also think of what you should say to the client with that response.
Exactly.
Anytime after, before or after.
Mhm. Excellent.
Possibly times when you have to elaborate, like they say, well, they're answering your question, but then they're like, but they might need help to elaborate and then to kind of maybe get a little bit more levity to what you're asking of them and give them that, extra time so that they can gather their thoughts again, because they might have gave you a response, but then might have not liked it or even really realized what they were saying, and then until
Excellent.
or they ask, well, what about this or that, and then, what do you mean? Asking those questions, what do you mean, and you might have to sit there and think for that time to kind of tone it down, or even just direct your question in a different way or word it in a different way so that they might understand, because,
Excellent. How about on Zoom land? When do you think you would use silence deliberately beyond the question, beyond asking just a question? They're effectively using silence.
Maybe to give the client time to think how to respond.
Excellent. And so, for example, in that case that you just brought up, giving a person a thing to respond is maybe you don't ask a question, right? And you simply define or explain a concept, okay? So maybe you explained, let me give an example. Maybe you explained a thought stopper when a person is triggering to trauma or to addiction craving. Okay, so you give this thought stopper that they stop themselves purposely, and they give a counter thought to it. Okay, so in some of these cases, we encourage them to put some rocks in their pockets so they start to tactically do something else with their body, or they have a picture or something like that to kind of stop that process. Okay, so you explain that and you give some ideas of what you can do, and then you just silence. Okay, and again, in your head, you count to 20. What just as what you was being said here, What does that do? There's no question. You're not looking for a response. You just explained a concept and then you purposely place silence there. What does that do for the client and for the therapist? Let's start with in class.
I think it gives, you know, because you're bringing a new concept in, so it probably gives the client something to, you know, think about. Whether it's has to do with their trauma or something about their addiction, and then it also gives you time to figure out, you know, like what he said, the response of what they're gonna say or what you should say right after that little bit of a pause, because you know, you're bringing something new into them, whether they have to think about it, you know, cognitively and maybe, you know, emotionally, mentally, all this stuff has to come together for them to even really get, you know, the full, maybe the scope of what you're talking about, or maybe they don't even, might not even want to talk about it. You know?
Okay. How about on Zoom land? That was an excellent answer. Anyone want to add to that?
I think he's definitely right on that too. It allows that time to kind of like let that information ruminate within the individual, but I feel like that's also the perfect timing for the counselor to take that silence as well, and you know, be able to see any nonverbal cues the client might be giving while they're processing that information that you've just given them, which can help, you know, better for the counselor to curate. Like, obviously, if the client is uncomfortable or, you know, showing signs of any kind of uncomfortable emotion for themselves, how to navigate that next part, or maybe seeing that they're relaxing into the information and accepting it, and how to positively move forward from there as well.
Excellent. So the two really important points that you brought up that are really important. One is it allows the counselor to see those nonverbal responses. So you're doing what's called a check for the room, and you're seeing if that was comfortable or uncomfortable. But then again, on the client's end, that also then, as was stated, provides the opportunity to give a truthful answer. When you finally say, so what do you guys think about that technique? So you give that silence and then you say, what do you think? What would you do to stop those thoughts? Now, I informally call this the bullshit scenario. Okay, because usually when you just explain a concept and then pressure people to think of something to do, a lot of times they'll say, oh, well, I got a picture of my grandkid, or I can do this, or I can do that. And it's interesting because everyone will just conform to what was being said. Okay, but in times when I've given that silence, I've got an honest response from a lot of participants that say, you know what? I think that's a bullshit idea. I don't think that'd work for me. Now that's much more honest than if they're kind of, again, using that nonverbal example, kind of rolling their eyes and kind of, oh, well, I guess I would do this and blah, blah, blah. They're actually giving you an honest response. Okay. And that's when you know, well, that's not, that idea doesn't work for them. How can we either make it work or try something else? Okay. But that moment of silence will give the opportunity to say, hey, that doesn't work for me. I can't see myself doing that. I'm too inconsistent, da, da, da. And it gives that opportunity for honesty. Okay. And so that's another planned moment for silence before you go on. So you explain a concept, silence, ask the question, silence, and you'll see that it actually kind of gives you a much more honest response. Okay. And then the other areas of planned silence are when you're going between topics. Okay. So in a session, if you're changing one topic to the next, giving that moment of silence from ending one to the other, providing silence at the end of group. So when you say, okay, everyone, let's just take a moment and reflect on what we learned today, give that silence and then give the closing part, okay? All of those are effective ways to do what we call transitioning, okay? For the client, again, kind of going back to this, is it makes time for connections, to wait for words and images to occur in their mind, to give that truthful response. It gives a space for feelings of being nurtured and allowed to develop, okay? A space in which times clients are able to recover from here and now emotions, okay? Because let's admit, this job that you all are wanting or in, people don't come to you because they're happy, okay? They're coming to you because they're miserable. And they're not only miserable because of either some trauma they're going through or they're in the addiction process, they're miserable just being here. Otherwise, they wouldn't be in your office. And so allowing them to feel what they're feeling right now is really important, okay? For example, with addicts, they will often, because they're feeling so miserable about having to be in that place, that puts them at high risk for relapse, okay? Just because they're not managing these emotions. And silence is an effective way to allow them to kind of feel what they need to feel, get through it, and know that it's safe to feel those things. Attempt to elicit response from the counselor, such as satisfying the need approval, as we mentioned earlier, giving that instant response that we regret later. And again, using the organizational use of silence allows them to think and respond. And if you just showed a skill, like I said a moment ago, it allows them to say, "No, I can't do that," or "Okay, let's give this some more room for conversation." Okay. Okay. So again, we want to reinforce that person-centered values that we've been talking about, that relationship between the provider and the client, okay? So this encourages the client to explore themselves, reinforces basic principles of what we're trying to do. Thus, and I'll just kind of read this, the client expects their counselor to provide advice and answers. Silence, perhaps accompanied by a warm, accepting smile, can be used to demonstrate there are more to be gained from looking within the self than being viewed by the therapist or the expert, okay? And this is one of the difficult parts, especially about modern treatments, is that we've got so indoctrinated in the idea that when we go to a doctor or we go to the therapist or we're going to give those instant answers that's going to kind of that pill that they then can use and heal or overcome an issue, okay? And while counselors and doctors and stuff are well trained in understanding human behavior and mental processes, the thing that I hope we all learn is that one solution for one person may not work for another, okay? And this is even true within medical treatments, okay? There is I believe there's 6 or 7, there might be more now, different drugs that can help a addict with their cravings or with getting nauseous when they drink or something like that. But why do we have 5 or 6? Because one pill may not work for one person, but works for another, okay? When we look at antidepressant medications, there's literally hundreds of them, seriously. Off-brand, on-brand, everything else. And all of them work on a different mechanism in the brain. Some of them work on serotonin, some work on dopamine, some work on both, some work on a totally different area of the brain. and neurotransmitters. But if depression was caused and is driven by the same thing, then there should only be one medication that works. If addiction is driven by just one single thing or one single issue, one pill should work, okay? And that's the important thing to know when we're going into this field, is not only do people react biologically different, we all react psychologically different, okay? And so giving that pill, that instant answer, is not really a benefit for our client, okay? But giving them that space to really understand their own situation and their own condition, and then helping them build the coping skills after that to help them heal from their situation, is much more beneficial than giving, well, you know, here's a worksheet, let's try this. Here's a technique, try that. And so kind of think about that when you're thinking about giving that space for them to grow.
Well, with what I think is, you know, you're giving them tools to have to utilize in their tool bag rather than giving them a Band-Aid.
Right.
Saying, here, you know, solve your problem, hopefully it helps.
Mm-hmm.
So you have a tool bag, I'd rather have a tool bag than a Band-Aid, you know, I mean,
Mm-hmm.
at least I can work on it than, you know, just keep thinking that I can put a Band-Aid on things, you know,
Mm-hmm.
I mean, that's, in my experience, you know, and that's.
No, that's an excellent analogy, definitely. Yeah. Okay, so encouraging autonomy gives the client autonomy within the session, okay? Again, giving them the space, giving them the ownership, the empowerment to drive the session. Okay, again, when we're looking at the counselor end, and we've mentioned this a couple times now, silence enables the counselor to collect your own thoughts and your own feelings, okay? And this is going back to our conversation on emotional intelligence, okay? I will also say this is a good time to reflect on whether or not you may be responding with one of your own biases or your own perceptions, okay? And I'll be honest with you, I've caught myself do this in sessions where I'm using silence and I'm thinking, okay, am I this person, okay, this is my, okay. And I realized that I was asking biased questions, or I was asking inappropriate questions. I wasn't learning about them. I remember in one session, it was with female inmates. Was it relapse prevention? No, it was a cognitive restructuring class. And we were talking about you know, culture and all those things. And back then, the term for a Mexican American was Hispanic in the little area that I lived in. So, and you know how that kind of changes from time to time in a community. It's appropriate to say Hispanic, Mexican, Mexican American, or Black, African American. So the what is that? The politically correct way to say it. And I was told in this area to say the word Hispanic, okay? And one of the clients finally, I mean, she like just slammed her chair. She got up and slammed her chair down. And she said, you know what? I'm tired of this. I'm not Hispanic. I'm Mexican. And I'm tired of you calling me a Hispanic. Okay. And so going back to her story that I didn't take the time to listen to, in an area of Mexico where she was raised, there was a class issue. There were people who were defined by Hispanic who had more Spanish inheritance, and there were Mexicans who had more Mexican inheritance, or what we actually should say Native American heritage. And there was a clash between those two, and both those groups had huge pride in that, okay? And so this example, and this is the reason why I bring this up, is what should have happened in a conversation about culture is tell me about your culture. But instead, I biasly put my own perception on who they were, okay? And sometimes you'll catch yourself doing that. And it's important to kind of use those moments of silence and kind of go, am I right? Am I asking the right questions? Am I biasing them in any way? Am I reflecting on this wrong? Okay. That was scary though. They actually had to bring in the corrections officer. She was mad, gonna shiv me or something, but no, she was not happy. But that's an example of knowing or using time during the session to reflect on whether or not what you're reflecting is correct. Okay, because in that situation, as I said, I did not step back and go, I don't know anyone who's culture in here. I'm making assumptions. And those assumptions led to a very bad event that occurred during a session. So, but that's just an example of making sure you really are connected with your group members or clients and know where they come from instead of assuming or putting your mind on theirs. Okay. All right. Okay, one other ways of, as we mentioned earlier, to use silence is to mark transitions. So natural ending to discussions. Clients may have to reach a natural end in a particular area. And this is when you know that it's good to kind of move on, is you can use silence to do transitions, and it's very effective, okay? But when you've beat a topic to its total end for your clients, their silence should be speaking to you, okay? Because if no one is saying anything anymore and you were having great conversation and now the clients are using silence, it's time to transition. It's time to kind of move on and go on with something else. So this is a two-way street when you want to transition, and then when you know the clients are ready to move forward is a good way to understand those moments. Okay. And again, I think these slides repeat themselves. Making connections. Silence gives clients time to make connections between feelings. I think we already did this one, didn't we?
No.
Okay. Well, actually, there are two important points on this one. The other thing that I know I've mentioned in this class before is there's a lot of people who go to a counselor and never return. And I know I mentioned this before, and we went back and interviewed them. And for the mass majority, it had nothing to do with the counselor or the organization or anything else. It's actually because they felt better. Their symptoms were alleviated by simply being in a space where someone says, you can tell me anything you want, except for, abuse of a child, intimate harm, those kind of things. But tell me anything you want, and it's going to stay right here between you and me. And then you, as the counselor, sit there in a non-judgmental, in all these body language ways, and allow that space to occur. Okay. And one of those spaces is silence. Okay. And allowing that to naturally occur within a session. And sometimes that's the first time this person probably has ever had the experience to have control over a conversation and to feel empowered that they're being heard. Okay. And we can think of this in many ways. It's not necessarily that they maybe have negative people in their life, but when people come to us with a problem, we want to help solve the problem, right? But we don't always listen to the problem, okay? And so this is the first time a lot of times they've been listened to instead of talked to, okay? While they may be familiar with physical sensations that emotions bring, such as knots in the stomach and tightness in the chest, it can naturally take time to find words to describe it, okay? So this, again, going back to the emotional component, this allows them to actually feel the emotions that they need to feel, okay? Again, when I talk about survivors of relationship violence and sexual abuse, Many of them if the situation was set up right, they may come into the session and cry for 10, 15 minutes. But once they stop, I always allowed that space, that silent space, because while they're crying, they're experiencing the emotion. But then after they're done, having that moment of silence allows them to process that emotion, allows them to understand it. Okay. And the difficult part is that when doing this in the beginning, a lot of them will say, "Oh, I'm sorry. I'm such a baby. Oh, I've just been so emotional lately." And then going, "It's okay. How about you just take a minute and feel it and not feel sorry for it, and give that moment of them realizing that it was okay for them to do that. They don't need to apologize. They can experience it, and then just giving that nice minute to just let them ride that out without the guilt." Okay.
What I see that it also offers is, of you being accepting of that and respond, you're like, okay, well, I see you're going through a hard time, and then you get that little bit of rapport with them, and then you gain some sort of patient to client, or sorry, counselor to client. You're able to sit there, and then they'll start opening up a little bit more, but also that you're allowing them to accept it while you're accepting them, but then you give them that time to sit with it. So I was told by a counselor, just sit with it, sit with how you feel right now. It's all right. It's all right. As long as you give that person an opportunity to let them know it's all right, then they get to breathe. And that's the biggest thing. They get to sit with it and they breathe, and then they're able to process things rather than, shutting themselves down again, like how maybe they were used to, like in a traumatic situation where they're not able to, freely express themselves. And that way that little bit of silence when someone says, sit with it, tell you what, in my experience, it helps, man, a lot, a lot.
Excellent example. Yeah. Yeah. Excellent example. So let's see. The other part of it is bringing out a nurturing feeling, a space where feelings can be nurtured and allowed to develop, just as you were mentioning, right? With just allowing that to grow and develop. Okay. And again, if we look at this from a cultural perspective, a United States dominant culture, and then there can be local cultures on this as well, is if we look at women, the expectation for women is to be overly emotional and expressive. Okay. If we look at men, the expectation is for you to hold your feelings in, hold your emotions in. Okay. And I want you to consider what this space allows a person to do is to let go of those cultural boundaries. Okay. It allows, for example, from a cultural perspective, a woman to sit there and go, "I'm not being overly emotional. I'm just experiencing something, and that's it." Okay. It's not because I'm a woman. It's not because I'm this. It's not because this is how I'm supposed to be. This is an honest, authentic thing that I'm experiencing. Okay. For men, what this allows to happen is for them to understand that it's okay to feel. It's okay to have emotions. And for a lot of men, it's the first time they've been allowed to feel their emotions. Okay. I think of moms and dads with little boys. When a little boy is crying, what's the most common response? Ah, knock it off. Go walk it off, right? Knock it off. You're being a wuss. Okay. And this is the first time they're not being told that they're being a wuss, or they're being a wimp, or they're not being manly for experiencing something that their brain is wired to experience, that their body and soul are wired to experience. Okay. And it can help bring out a more authentic self. Okay. But also, especially when we're dealing with things like addiction, those emotions and feelings that have been miswired, as I'll say, are often the root cause of a lot of addiction. Okay. Not repressing these emotions And then having outbursts of anger or not understanding oneself often lead to addictive processes. Okay. People who go through trauma are expected to not have that trauma affect them so much. It's something that happened to you. Knock it off. Move on. Why aren't you like everyone else? Okay. When realizing that those feelings, those trauma feelings, are normal. They're what we're supposed to experience when we go through something traumatic. And they're not something to be buried deeply inside, because all of those emotions are our warning system that we need to change something. And if we are expected just to be emotional, or if we're expected to bury those emotions, then we're not using our body to its best effectiveness, our mind to its best use, if that makes sense. Okay, and again, going on with this, it fully engages with the emotion. Okay, again, being previously suppressed, or something that, oh, I'm just a woman because I'm feeling all of this stuff, or whatnot. Silence allows that space for it to be fully processed and fully felt. Okay. All right, and as I believe you mentioned, and Zoom mentioned, sorry, I'm having name issues today. People on Zoom said body language during silence can be a very telling sign of where your client is at and what they're experiencing. So we speak about different tones of voice. We can also look at silence in different tones as well. Again, silence in counseling is not just about physical presence, but yet quiet. Okay. So one of the, again, this is a counselor development thing. One of the tempting things to do as a counselor, or just as a human being, when there's silence, is to change focus. So I've seen a lot of counselors like pick up their pen and start making notes, start looking at the clock, start kind of tapping their legs, or doing those unconscious type of da-da-das. And what message, let me ask you guys this. I'll start with, let's start with Zoom this time. When a counselor is engaging in those behaviors during moments of silence, what nonverbal communication is that counselor sending to the client? Let's start with Zoom.
That she or he is in a hurry?
Mm-hmm. Yeah. So it's showing that you're uncomfortable, right? And we need to kind of, let's hurry this up. I'm uncomfortable with this moment. Okay. And what is that taking away from the client? Their power and their ability to feel like this is their session. You're taking away that centered person component. Okay. And again, I'm going to say this isn't always the counselor's fault. We all have habits. Okay. And this is where it's that time, like I said, using silence, being conscious of your own self and reflecting on yourself and how you're acting. Okay. Because that's another thing that you want to watch out for, besides questions you've been asking or everything else, is how are you responding to them in that moment. Okay. And on the client's end, we can see, if they're getting uncomfortable, if they start looking at the clock, if they start kind of hunching over, we know that probably at that point, that question or that experience they're having might be a bit too tense, or they might not have understood what you asked. Okay. So looking at them and seeing if they're becoming more and more distracted in that moment, and looking for you to kind of move things along, either that they're experiencing something that you may want to intervene on and say, how are you doing with this question? What are you thinking about? Or maybe they just didn't understand. Okay. And then just repeating the question and whatnot would be helpful. So looking for those cues. It requires full presence of the client within silence. The words psychological contract that needs to remain in place, meaning that you stay connected with them. And maintaining a presence with connection is of course important. Observing body language, all of those things that we need to do. Okay. Did you guys have anything you wanted to add to this?
Well, with that, like, of course, you have the patience. Patience is, just sitting, you yourself sitting with it and having, because once that person feels rushed, or they might get agitated, they might even shut down, they might not even want to be there no more, and then that you're giving them, it's like you're allowing them to be present with you, being present and being patient, because it's not like a light switch where you can turn it on and turn it off. Your feelings, you have to allow your feelings to come to the surface and be heard, and because an individual, they're having a human experience, and being able to see that and feel that through their body language, you're going through that journey with them. And what I've seen is that human experience, you're also having that experience too, because you're also learning about that individual, and you're learning what they've been through physically and emotionally, and by listening and really seeing and conveying what they're going through, and then they're that silence too, and then also picking up on what you ask them another question, the question maybe they might not even get the question, but then asking the same question in a different way, and then also so that they might understand it, or actually hear what you're saying, because when someone thinks about stuff like that, that's traumatic, what I've seen is they often go to a different place, mentally, and then you might need to reel it back in and, center them back to, hey, we're here, I'm right here, then but then they might be able to give a response to you after, because they might be going through a lot of emotion at that time when they're just sitting there thinking about what happened, That's just what I've seen anyway.
I think those are great examples of utilizing that space, right? Okay. And I do want to add just a few things on there, because you said some kind of two important things. Is one, you are in a congruent state with the client, and you're in an empathetic state. So you are experiencing their trauma as well. Okay. Have I explained mirror neurons in here? All right. This is something cool about human beings and other species. It's really kind of fascinating. Okay. We have what's called a mirror neuroning system, and it was first discovered in chimpanzees. But then further research went on. I guess we have it, elephants, dolphins, and most of the primates have this mirror neuron system. And what that is when you're closely paying attention to someone else, the same exact neurons that are firing in their head start to fire in your head. Okay. So one good example of this is if you're ever at a movie and there's a high action scene where there's a lot of movement, and the car might turn one direction and you might see everyone lean one direction, and then they turn and you see them lean another one. That's because studies that have been done have shown that the neurons that were firing in that stunt person's head when they were doing that stunt start to fire in the audience's head as they view it. Okay. Another good example of this is if you ever, this comes from dating, watching people on first time dates. Okay. If you're really bored at a restaurant, and because you're, if you're in human behavior and all that kind of stuff, and it interests you, and you're bored at a restaurant, try to determine which people are there on their first date. And you'll be able to predict if there's going to be a second date. Okay. You can also do this if you're dating, if you want to see if this is going to lead to something else. What will happen is at the beginning of the date, they'll bring the food out and stuff, and they'll set the food and the glasses where they're comfortable. Okay. But by the end of the date, if the couple really are in sync with each other and they're mirror neuroning with each other, their plates will be in the exact same places. Their forks and spoons will be in the same exact places. Their glass will be in the same, they'll be sitting exactly the same, and their hands and body language will match each other. And they'll start doing what's called mimicry, where when one takes a drink, the other will take a drink. When one takes a scoop of food, the other one will. It's kind of weird to watch because it's like it's almost like they become one person. But you'll know if that happens, they're going to have a second date, and you can almost guarantee it. Okay. But this is the state that we want counselors to get in. Now, I do have to say it's a little bit more complicated. That we have the mirror neuron system that pays attention to nonverbal physical activity and language. And then we have in humans, we have a mentalizing system. A mentalizing system is taking that information from mirror neurons and taking what we know about the experience that person is having, and we interpret it. We mentalize it. We mentalize what they're going through. Now, that is unique to humans and elephants, but not necessarily our chimpanzee and relatives. Okay, so it's kind of a cool thing. Okay, but this is a long way around to go into what we're going to talk about later in the course. It is very easy, especially if you're going to work with people who have gone through trauma. Even with a lot of addiction issues, especially if you struggled with addiction as well, to become what's called vicariously traumatized. Okay. Vicarious traumatization is getting in a traumatic state and triggering to trauma that occurred to someone else. Okay. And so while it is important to get in that state with your client, this is the other area of silence that you want to start to utilize, is you want to keep a check on your own trauma response. Okay. For two reasons. One, so you don't become vicariously traumatized. You're just experiencing with the person what they're experiencing. It's not your experience, and kind of making that line. But the other thing is if then you start to trigger to that trauma, you're going to become uncomfortable with the counseling session. You're going to start doing triggering behaviors such as enclosing yourself, folding your arms, and becoming very anxious about having that conversation any further. Okay. So when we get to self-care, we'll talk about how we can manage those emotions that will naturally come up. Okay. Now I'm trying to think of the second thing that you said. You mentioned experiencing it with them. And then you said something else. Do you remember? Okay, well, all right. Maybe it'll come up later. I went off on a tangent. All right, and we'll close with this because it's an important point to make after a conversation that we just made on silence. Empathy is the ability to perceive the internal frame of reference of another with accuracy, with the emotional components and the meanings which pertain thereto as if one were the person, but without ever losing as if conditions. Okay. And so that kind of closes us up on silence. It looks like we're doing good on time. Do we have any questions here on campus?
Well, what I said was, or when I think about it, was asking questions, but in a different way so that the individual understands them, or maybe, you know, to also bring them back as well from, you know, maybe thinking about the trauma, and then you're centering them back again to, you know, like, you know, because when my own experience, when I've seen veterans do that, is, you know, you're asking these questions, these very interpersonal questions about, you know, a certain situation, they lose themselves, you know, they already start thinking about it, and then you see that stare gets in them, they get out of the room, they get out of wherever they're at in their headspace, and then you got to kind of reel them back in, and then ask them again, and then it gives them a chance to sit with it, and then they say, well, you know, and then whether or not they're able to continue from there, then they'll give you a response. If not, then you can say, no, that's all right, you know, and move on to something else.
Yeah, that's a excellent example of how to use that nonverbal behavior, right? And realizing where they're at, and then realizing, well, maybe I should reframe the question or something like that. Excellent. Yeah, that's an excellent example of an effective use of silence and effective use of reading nonverbal cues and behaviors. Excellent. Yeah, thank you for that. Any other comments, guys? All right, Zoom land, it's up to you guys. Do you guys have any questions, comments? I'm gonna, yes,
I was just gonna ask if you could upload this PowerPoint and the last one from Tuesday's class to Canvas.
it should be there. It's under facilitation skills.
Oh, okay. I was trying to look for it and I wasn't finding it. Didn't know what it was called, but got
Let
it.
me, I'll look again and just make sure, but I thought for sure we put it there. But I'll check and make sure.
Awesome. Thank you.
Mhm. All right. And Lucinda, you excellent example of using silence and then eventually the client saying, "Well, can you ask that again?" That's a good example of Lucinda. If you everyone wants to read her example about client just kind of sitting there and waiting. Um, all right, gang. All right. Have a good weekend. Take care of yourselves. Come back Tuesday.
Bye. Have a good weekend.
You too.